My name is Emeline. I'm a second-generation Vietnamese American. My parents are refugees from Vietnam. I was born in Texas, grew up in the Midwest, and currently reside in California. I've come to understand that the different aspects of my identity as an Asian American are tied to my experiences growing up in different parts of the United States. I'm curious about the different intersectionalities that influence our Asian American, Native Hawaiian, and Pacific Islander communities. We are as diverse geographically as we are ethnically and culturally, from the Pacific Northwest to the Northeast, from California to Texas. I'll be traveling to different cities and states all across the nation to highlight the stories and challenges that make up our unique diaspora and also what brings our communities together. I'm in Southern California for my last trip. California is home to the largest Native Hawaiian and Pacific Islander community outside of Hawaii, and I'm here to visit folks that represent and are a part of the NHPI community to hear their stories and perspectives. I made plans to meet with some of the staff from the Pacific Islander Health Partnership, also known as PIHP, at a public park in Huntington Beach. The Pacific Islander Health Partnership is a public health nonprofit focused on serving multi-generational Native Hawaiian and Pacific Islander communities in Orange County. I had the pleasure of speaking with the co-founder of the Pacific Islander Health Partnership, Jane Kali Kahi Kino Peng, where she talked to me about the origins of PIHP.
In 2003, my husband was diagnosed with a brain tumor, which sort of necessitated my leaving my job with LA County. And as a result of that, he went for surgery and was discharged, surprisingly to us, after brain surgery in 24 hours. So with time on our hand and me attending to Victor at that time, we decided that if it worked for Los Angeles, if we got together some of our faith-based and community groups here in Orange County, why not try to bring the community together here in Orange County? So from Westminster, Garden Grove, Santa Ana, Costa Mesa, we'll pull together the Samoan, Tongan community, the Chamorro and the Marshallese community, and met at the Orange County Asian Pacific Islander Coalition, OCAPICA, Community Alliance in Garden Grove. Started with that, and as a result, we decided the name for the new organization would be Pacific Islander Health Partnership, with focus on health, to promote access to health, as majority of the communities we're serving at that time had very little resources for health access. So working with them to build a system by which they might be able to access not only funding, but full evaluations and health care through the local resources. So that started us in 2003. The focus when PIHP was organized, we had two focuses, one on outreach to our youth and to our elders. So those two communities are still very, very special to us in the work that we do.
During our time at the park, we decided to have a picnic. After finishing our food, I talked to Charlene Kasner, the board secretary of PIHP. Charlene provided insight about the challenges the NHPI community has faced during the COVID-19 pandemic.
You know, COVID-19 has really been an eye-opener for all of us. Prior to COVID-19, we were very much involved in heart disease, stroke, diabetes, different types of cancers, obesity, weight management, and those are the health disparities and whatnot that we focused on. Then COVID-19 came, and then our focus changed. So we had to pivot very quickly so that we could support our community, because as you know, the Native Hawaiian Pacific Islanders were the highest ethnicity or race for all of COVID-19. Our numbers were so high. And so we saw that early on, and which is why we got involved with Southern California Pacific Islander COVID response team, which is based out here in Southern California. So as a part of that team, we, PIHP, have been very much involved in going out to the community and even getting, in collaboration with other CBOs and other organizations, acquiring different grants and funding in order for us to go out into the community and do the work that needs to be done to support our NHPI for COVID-19.
After hearing from Charlene, I sat around and listened to more stories from Jane and also Ulani Ho'opai, the executive director of PIHP. A big part of NHPI culture is engaging in an activity called Talk Story, an oral tradition in Hawaii where you sit among friends and pass the time by chatting with one another and swapping stories. I felt honored sitting alongside 3 longtime friends and hearing them reminisce about Hawaii and the old times. Earlier in the day, I met with another Orange County NHPI nonprofit and a partner in the work with PIHP, the Orange County Asian and Pacific Islander Community Alliance. I had the chance to speak with Clara Ashu, the health program supervisor at OCAPICA, where she told me her hopes for the NHPI community.
I have big hopes. I think one of the things that I kind of envision is an HPI community having a Chinatown-like area where, you know, they have a place to feel safe and flourish culturally. I think imagining a place where, you know, we can have NHPI businesses that, you know, cater to food, cater to entertainment, even cater to maybe having a CBO, a community-based organization there. And, you know, a place where we can speak the languages, you know. I think if we can get that back, we can get a lot of other things back. And we even create a place where our families feel a little bit at home. I think a lot of times that transition from home to here in the States is very drastic, and I think a lot of our community kind of understands that, you know, that takes a toll on your mental health. So being able to provide those services, I think too, just exposing the world to like that NHPIs are more than just amazing entertainers and really athletic bodies, right, that we're known for. So just being able to give that aspect to where people can come see it and see it for themselves and really get a chance to know the community the way that I know the community and fall in love with them like I know they can. So yeah, big dreams, big dreams.
Back in Huntington Beach, as my day spending time with my friends from PIHP came to an end, I felt an overwhelming sense of joy. The power of Talk Story is its ability to connect with those around you and feel a sense of belonging. I've come to realize that this is what I've been doing during my travels to different cities across the country, listening and being in community with different folks that represent our Asian American, Native Hawaiian, and Pacific Islander diaspora. All of the community-based organizations I've visited are a part of the Asian and Pacific Islander American Health Forum's National Partner Network. Highlighting their work and talking about the challenges our communities face is instrumental in advocating for and improving the health of our AA and NHPI communities. To learn more about our work, visit our website at APIAHF.org.